Biophilic design and design elements can play an important role in many design settings. But what elements are best suited to healthcare settings, and what are proven examples of their benefits in these settings? To understand these issues, 3 case studies were examined that researched the influence of biophilic elements in these settings. The results provide a glimpse into tangible patient benefits, both physiological and psychological, as well as benefits for healthcare workers. In this study, 90 post-surgery surgical patients across 10 hospital rooms were split into rooms with identical views of the sky and other buildings, but no views of vegetation. Half of the patients were provided with plants in their rooms, while the other half of patients were provided no plants. The plants made statistically significant impacts on patient data gathered on pain, anxiety, fatigue, and patient room satisfaction. The overall conclusion of the study was that the plants had a measurable positive influence on health outcomes of surgical patients post-surgery, including lower systolic blood pressure, lower pain, and higher room satisfaction. In this study, the research team wanted to determine if flowering plants specifically could reduce depressive and anxiety symptoms in patients that have high levels of anxiety and depression during and after hospitalization. Hypothesizing that flowers reduce stress responses and provide a distraction by imparting positive moods, 135 patients were split into an intervention group, which received artificial flowers that remained throughout their hospital stay, and a control group that did not receive flowers. Results showed that there was a significantly smaller increase in depression symptoms at 3 months after discharge compared to the control group. Biophilic benefits don't only apply to patients. This study covers the effects of biophilic elements on medical care providers. Conducted in 2020 during the COVID-19 pandemic, the research team developed multi-sensory recharge rooms at Mount Sinai Hospital in New York City. The environments included imitation plants, projected landscape scenes, color-matched lighting, nature sound immersion, and essential oil immersion. The results showed that, following a 15-minute session, healthcare workers saw a 59.6% reduction in self-reported stress levels, showing that the rooms can provide significant reprieve during high stress and high fatigue events. While there is plenty of room for further study, these case studies show that designers have many opportunities to provide biophilic elements in their designs, as these elements can have an immediate impact on both patients and healthcare workers.